Hey, this is Doug Field along with my co-host Ron Bachman, and welcome back to the final segment of Healthcare Consumerism Radio. You know, Ron, we just got done talking about the various different exchanges, private and public, and we're really pleased to have the next guest on the program. He's CEO of one of the leading private exchange platforms in the market, Array Health. Joining us is Jonathan Rickert. Jonathan, good morning.
Good morning.
Hey, good to have you here.
Me on.
Good to have you here. Coming all the way from Seattle, right?
That's right. That's right.
Well, Jonathan, give our audience a brief overview on Array Health and your niche in this space, please.
Certainly. We are a company that's been on a mission to simplify the process of purchasing health insurance since 2006. Currently, we specialize exclusively in private health insurance exchange technology, and we provide health plans the ability to offer a private exchange to employers and members. And it combines a state-of-the-art marketplace that gives people the shopping tools they need with decision support technology. And also, we handle a lot of the complex stuff on the back end, integrating with all the myriad systems out there to make the entire business model flow seamlessly.
So you work primarily with health plans to enable them to provide an exchange to their employer population and their members.
That is correct.
Excellent.
And really what we're doing is we're giving them the ability to have a strategic sales channel that they control and an ability to get closer to their consumers and to offer different products to different consumer segments.
Jonathan, this is, we talk about it a lot. This is probably one of the most disruptive open enrollment periods in the 30 years plus history of healthcare benefits, and I think it's a positive. I mean, public exchanges set aside, I think you've got a market that is engaging in defined contribution of private exchanges, and you've got what some studies show 90% of the employer market that is saying they are going to seriously review what is happening this fall and how exchanges are working as they plan their 2015 plan year. Are you seeing some of the same out in the market where you are?
Yeah, absolutely. I mean, there's just a lot of excitement and interest in private exchanges. I mean, I think in the new world, carriers will be multi-channel. They'll be selling through the public exchange segment. They will be pushing products through the off-exchange channel, and then there will be the private exchanges out there that will also serve as a new method to distribute products. So it's an incredibly exciting time. There's a lot of enthusiasm about these changes, but at the same time, there's certainly a lot of confusion in the marketplace too.
Yeah.
And some of the challenges on the public side have created some concerns about, especially younger, healthier folks enrolling in these new marketplaces. But I mean, I think that will all settle down as the dust settles. Health plans and others will look ahead to the next year and be able to think strategically about what needs to happen.
Jonathan, this is Ron Bachman. Do you think the problems with the government exchanges and the difficulty of enrolling will carry over and sort of taint the private exchanges, or will private exchanges be able to position themselves as the effective answer to actually getting enrolled?
Yeah, I think that the public exchanges are certainly a very positive step in the right direction, and it's going to get many more millions of Americans coverage, and we're certainly very excited about that. But the private channel, there's a lot of excitement about what can be offered via a private mechanism, and it's really a better user experience, different types of products, giving employers a defined contribution offering, and advanced decision support capabilities and consumer experience. So I think that those elements will certainly be attractive to consumers, and hopefully over time the public channels, the public exchanges, will adopt some of those innovations that are happening in the private sector.
Just so our audience is clear on what your business is, you talked about selling to the insurance companies. Do you also sell, say, to brokers who want to set up sort of their own exchange and make it easy for people to sign up with multiple carriers? And is there anybody else that you're selling to besides providing the technology behind health plans?
Yeah, so the primary audience is the health plan. The health plan can use the technology to distribute via brokers, which many do, or to sell direct to employers. What you're referring to is a multi-carrier model,
right,
where we license the technology to a brokerage. That's something our technology can support, but is not our current focus today.
So most of your sales are sort of the single carrier exchanges?
That is correct.
Okay. Can you share with our audience some of your clients? Who are you working with, so they'll know that you're sort of the backbones behind some of those?
Yeah, certainly. So we're a private company, so we can't disclose our customer list, but one of our largest clients has agreed to serve as a reference, and I'm free to speak publicly about them. That's Highmark Blue Shield in Pittsburgh.
Okay.
It's a health plan with 4.8 million members. Yeah. We're their exclusive private exchange vendor, both on the commercial active side as well as on the retiree side.
That's a great reference.
We also are moving into Delaware and West Virginia, with them here in 1/1.
That's a great reference, because that is a very creative, inventive part of the country, and that system that you're talking about has been very much in the forefront. So I think that's speaks highly of their selection of you guys as the backbone. It's interesting that you're doing more on the East Coast and you're sitting on the West Coast.
Highmark's been great.
Yeah.
They're a fantastic client, and you're absolutely right. There's a tremendous amount of innovation happening in Pittsburgh right now with the hospital purchase and some of the other really cool things they're doing with brick-and-mortar health insurance stores and other types of innovation. So
that's very innovative. When you look beyond kind of the general excitement and the buy-in from some of the market, whether it's health plans, employers doing this, what are some of the biggest challenges the market faces, the private exchange market faces right now?
I think just confusion about really what is a private health insurance exchange vis-a-vis a public exchange. I think some of the technologies out there are a bit dated, and they're basically being repurposed, whether it's a TPA that has repurposed their system to get into the exchange business, or an open enrollment company that is trying to pivot over to this very large private exchange opportunity. So I think the technological challenges that exist, especially with the data integration complexities, can create a difficult experience for the consumer. So I think those would probably be the two biggest areas of concern right now.
Jonathan, I think there's a confusing point that we look at and hear about on a regular basis. Can a private exchange provide a gateway for subsidized employees to go to the public exchange?
So we don't do a lot of work in the individual market currently, so I'm not the best person to comment on that.
Okay.
We're primarily selling to the carrier that uses the technology in the employer segment, and that's really where we started the business, was servicing small to medium-sized employers using a defined contribution approach. So my understanding with the web-based entity, there are opportunities for private companies to enable enrollments, but I can't speak about specifics.
Okay, got it. Appreciate that.
On the product side, does your technology support more than health insurance? Does it support some of the other products that might be offered by carriers, life insurance, disability products, long-term care?
Yeah. So this is a really exciting trend in the industry right now. Health plans have a tremendous appetite to sell other types of products. And and hence the name Array Health. I mean, it was our vision from day one to provide a wide range of different products. So health plans realize that it's going to be more and more difficult in the future to make money on the core medical products. So they're looking, and that's because of the MLR requirements, obviously. So they're looking to sell all sorts of higher margin ancillary products, whether that's, you list them off right there, dental, vision, long-term or term life insurance, accident insurance, critical illness insurance, those types of things. So what's really nice about a private exchange is that those products are embedded into the shopping experience that consumers have gotten very used to using. Whereas you think back to the old days, take-up wasn't as high when you had a broker or a representative from the carrier at an open enrollment meeting, with a card table and paper applications, right? It created adoption hurdles for consumers. Now it's all embedded into the shopping experience, all online. It's very easy for members to use their defined contribution dollars from their employer to buy not just core medical, but these other products.
Hey, Jonathan, we're kind of coming up on a hard stop. I hate to end this, but it's been great having you on here. We'll have to do it again. Give our audience some basic information on how they can get in touch with Array Health.
Certainly. The best way would be to visit our website, www.array, that's ARRAY health.com. And there's also an email address there, hello@arrayhealth.com. Feel free to email us with any questions or comments, and we'd love to have a discussion with you.
Thanks, Jonathan.
All right.
Enjoy your weekend out in Seattle. To our audience,
thanks so much.
Thank you. Stay tuned for next week's program.